I'm Richard.
And I'm Justin.
America is one of the frontiers for advanced medicine today, with increasingly new technologies and innovations that make medicine better here than anywhere else in the world. Yet there are so many Americans, especially in the urban areas of New Jersey, who just don't have access to quality healthcare. And in planning this trip, we really wanted to figure out why.
And healthcare is incredibly expensive. One out of every $6 that is spent in the United States is spent on healthcare. So that means no matter what your cause is, whether you care about the environment, education, prison reform, you gotta care about healthcare.
In planning this trip, we really wanted to make sure that our participants could get a nuanced and multifaceted perspective of this labyrinth that is healthcare in America today. And this is why we visited various stakeholders, such as politicians, nonprofits, consulting groups, and hospitals, so we could get their take on what their goals are for medicine in New Jersey and the challenges that they faced.
We want to share with you some of our experiences, tell you a little bit about the people we've met with, and share a little bit of the knowledge that we've gained. We've had the opportunity to meet with some really cool people, and in this video we want to share that with you.
I think the biggest problem in American healthcare was access to quality, affordable care.
I mean, a lot more plays into keeping people healthy than just giving them medicine when they're sick. And in the U.S., that's not really being addressed. And our health is about a lot more than just taking care of sick people. There are a lot of social determinants of health.
I think one of the most surprising things I learned on this trip was how interrelated healthcare is with so many other aspects of our society.
There are sort of some universal patterns that play an equal role in our healthcare systems. The role of mental health, housing, transportation, and education, and how regardless of where we stand in our healthcare system, if we are not putting enough emphasis on those four sectors of the society, we're not really able to approach our healthcare problems in a effective manner.
And one day in the emergency department, when every exam room was full and we had patients in the stretchers and the hallways, we were just really busy. I had this epiphany that most of the patients that were there for the medical manifestation of a social problem. And that was a really huge awakening for me, because we did great work. We practiced great medicine at Albert Einstein Medical Center, but when patients were discharged, they were going to be discharged back into the environment which originally brought them there. And we as physicians and medical providers were not in a position to address those social problems, those social determinants of health.
Coverage does not necessarily equal access. As you can get people insurance, but if people don't have transportation to go to their providers, or there's just different issues, they can't get off work, even though there's a greater financial incentive now for them to go see the doctor, there's still other things that are preventing them from getting there. So there's still many issues we still need to address, often in the social determinants of health.
Here's the policy side. There's also the implementation side that has to happen. To achieve certain goals, you actually have to tap into third-party sources such as Schaefer to deliver innovative ideas to implement these tasks. Now, I thought healthcare all along was something that a single policy can change, but it turns out that there's so many different factors involved, so many different parties on different levels that need to come together, agree, and implement the proper solution.
In our domestic system, outside actors are some of the key people and institutions driving innovation, improving healthcare for everyone, and making delivery more effective and efficient.
One thing I really liked was DEFCO. DEFCO was not simply acting to improve how medicine or the costs of healthcare, etc. They were actually working to prevent people from even reaching the state of having to be hospitalized by building the urban health center, which had a fitness center, a pool, a fresh grocer, that actually helped to keep the surrounding area healthy and prevent them from even reaching the state of going into the sickest 1%.
So I was really excited when we went to talk to the people from the Camden Coalition, just because it seems like with data mapping and their interventions, they've been able to make a really huge change in Camden. And if they actually are the first city to bend the healthcare cost curve, that would just be so exciting, because they're one of the poorest cities in the country, they're one of the most violent cities in the country. And if they were one of the first cities to do this, to really be able to improve quality while still reducing costs, there's no reason that other cities can't do that.
We have a tremendous opportunity. About 20% of the population in Camden are uninsured, and they'll now be eligible for health insurance. So we know the critical impact of getting people access to health insurance and what that can have for their well-being, their community and life.
This trip really reaffirmed my belief in the importance of learning about subtlety. Healthcare is an extraordinarily complex issue. Health doesn't just mean going to the doctor and feeling better immediately because you got a prescription. It means being able to have support from your family to feel better. It means being able to get exercise, to feel safe walking around your community. It means having access to healthy foods. It means having access to housing. And it was really exciting to know that a lot of these organizations have that mindset and they understand and are working towards a new definition of healthcare that's not just between an insurance provider and a doctor or a hospital, but between different community organizations, different government organizations, and different ways to getting social services to all Americans.